Thank you. Again, exactly on time. Next is John Holmes talking about online discussion forums as potential sources of adverse drug event data.
Okay, good afternoon. So continuing along the lines of this online source of data here, I'd like to focus actually on online discussion boards as opposed to things like Twitter, Facebook, and the other social media. So just to make sure we're all on the same page here, a discussion forum is an online resource and a social media resource where people can participate in actual conversations. And those conversations are actually documentable so that you can look at them post hoc as if they were a conversation that was happening in real time. They're generally pretty topical, so people don't start a conversation and go off on some sort of a tangent too often until much more deeply into the conversation. I'll talk a little bit about that later. It's a phenomenon called thread drift. And they're often used for seeking advice, especially in terms of these medical discussion boards, which I'm going to focus on now. So here are some things to keep in mind about how discussion boards differ from other online information exchange resources. And I just want to point some things out here. I don't know if, oh, okay, that's pretty hard to see. So discussion forums, as I mentioned before, are pretty topical. Facebook, not always. It depends on what people feel like posting. Twitter, same thing. Chat, they're often topical. People generally get involved in a chat room to talk about something in particular. Can you elucidate the conversation from evidence of this repartee on the social medium? In a discussion forum, as I mentioned before, you always can, because actually that's what is documented in a discussion board. In Facebook, sometimes. In Twitter, not if you're using sample data. So as we often do when we're doing Twitter research, we'll download a certain percentage of tweets through their API or application programming interface. Can we elucidate a social network on a discussion forum? Unfortunately, that's pretty hard to do. Pretty easy to do on Twitter, and even easier to do on Facebook. There are lots of reasons for this because of the way people are identified, posters are identified in these various resources. In chat, it's pretty hard to do. The mode is asynchronous for all of these except for chat. If you've ever been in a chat room, you know that you just post a message, somebody else posts back, and it goes back and forth like this. It's almost like having a phone conversation. It doesn't really work that way in a discussion forum, not usually. But there are serious privacy concerns with all four, and that's really what I'm going to focus on towards the end of my time up here. So that's why you have 4+ signs here. There are some very serious privacy and confidentiality issues for all four of these. The data are sometimes available for a discussion board. And again, I'll talk about some of those issues from a regulatory perspective. On Facebook, pretty hard to get sometimes. Actually, their terms of service agreements are somewhat difficult to navigate. And the same thing is true of chat rooms. Twitter, the data are available. They're actually freely available if you use the sample. There are some definite syntax issues with all four of these. And as you can see here, especially with Twitter, because you're limited to 130 characters, whereas in a discussion forum, you also have this problem because people are using a lot of synonymy and abbreviations, and I'll give you some examples of those. And the focus of social media research, in terms of what you see in the literature, what people are actually writing about, lots of folks are writing about using Facebook and Twitter for doing research of all various types, not just biomedical research, but others. But not so much actually on the discussion forum. It's not quite as common. So why would we use a discussion forum or discussion fora for looking at adverse drug events? Well, we can find out from what people are saying on these discussion forums, what kinds of drugs they're using, what kinds of supplements they're using, as in nutritional supplements, vitamins, things of that nature. We can actually identify therapeutic effects that have been identified or experienced by posters or others, the side effects for certain drugs or that posters or others have posted, others being people who are, let's say, posting as a proxy for someone else that they know or a family member. That happens all the time, by the way, on discussion boards. Attitudes and beliefs and sentiments, which is an incredibly rich and important problem in social media, and especially in discussion boards, because many times people have much more opportunity to express themselves, enough to the point where you could do an actual sentiment analysis, and I'll talk a little bit about that later. and the identification of possible sentinel events, especially adverse drug events. And again, it's a conversational platform. You can see a thread of a conversation from beginning to end and really identify a number of features from there, including discussions about adverse events. So here are some threats. As I mentioned, there are restrictive terms of service policies associated with certain things like Facebook. Well, there are with discussion boards as well. Some of them are very open. Some of the ones that I've used in my own research have been actually much more open than others where we've been hit with so many restrictive covenants in the terms of service that we just gave up. It was just too difficult. There's also the problem with user aliasing, where people can post, the same person can post as 2 or 3 or more people. We call them sock puppets, as in they put a sock on essentially, and yes. So it's not my term, it's actually a very commonly used term in social media. And then there's thread drift, where somebody will start talking about something like, oh, let's say a medication for breast cancer, and then the next thing you know, somebody's talking about prostate cancer. Happens fairly frequently. The discussion sometimes continues across threads, so you could be looking at the thread as a unit of analysis without realizing that another thread actually continues that discussion. That happens very frequently too, and sometimes without any warning or indication that this is happening. And then there is the syntax. You get smiley faces. How do you analyze that? Oh, it's, you know, the first one looks like a colon with a right parenthesis, or with a left parenthesis for the frowny face. But then that's even more difficult because that's a GIF. That's a graphical interchange format, so that's extremely difficult to understand if you're going to parse these data. Remember, these are all text, except for something like that. And then there are abbreviations. So seriously, be back later, in my humble opinion. You have to have a controlled vocabulary that can deal with these. These are all extremely important, by the way, because they speak to the issues of things like sentiment and attitudes and beliefs about what people are posting. And then Tammy, I've actually seen this one. Is it tamoxifen or is it Tamiflu? Good question. Okay, so here's how we do research, or how we've done research in our shop here, looking at data like this, where you have a lot of websites up here at the top in blue, and we have web crawlers. There are lots of web crawlers out there you can download off the web. We ended up building our own, and we actually scraped the sites that we came back with after crawling, identifying them using a controlled vocabulary of terms that we were looking for. We scraped terms, again, using a scraper that we built using our own controlled vocabulary. And using this is all going on at the same time, what you see in the green and the blue. And eventually we have a de-identified corpus that we can apply our ultimate controlled vocabulary to extract information from and develop our set of findings. Okay, so it's basically works sort of like this. Okay, so here's an example. This is a study that was funded by the National Library of Medicine under the stimulus program using the internet to identify adverse drug effects. This is at first intended to look at the adverse effects that might be associated with various and sundry nutritional supplements that people are not likely to talk to their physicians about. We figured if they didn't do that, they're probably talking about it with friends on the net. So this is a paper that was written by my colleague Jun Mao, one of my collaborators on this. And the idea here was to understand the frequency and content of side effects that are associated with exposure to aromatase inhibitors. So the methods here, we used a mixed methods approach here, quantitative and qualitative, where we did some content analysis on the actual text, but also word frequency accounts and the like. So we determined the frequency and the association between side effects and AIs and identified some themes. And we looked at 1,000 randomly selected messages. So here's an example thread. I know you can't read this, so I'll just read it quickly for you. The only SEs, or side effects, I had on tamoxifen were weight gain and hot flashes and night sweats. By the way, what you see in bold is what was in our controlled vocabulary. Has anybody been suffering from chapped, cracked lips, especially at the corners of your mouth, since being on Arimidex? I had this problem many years ago, but always could fix it by taking vitamin B complex. The vitamin B complex isn't helping anymore, and I'm wondering if Arimidex is causing this. By the way, this is one thread. And I should also mention a regulatory issue here. Unless you obfuscate this text, if you're going to present it in publication or in a public forum like this, somebody could take this and Google it, and they could go right to that discussion board, thereby re-identifying the person who posted this. So that's one of the things we have to worry about. Okay, so I know I'm going to be hitting the red light very shortly, so I'm going to just scoot right through these, but you can see actually that this thread continues on and on. It talks about a number of side effects from conjunctivitis to hypercholesterolemia to dry eyes, you name it. And one of the important things for us was actually the identification of weight gain. 25,000 posts related to aromatase inhibitors, and 18% mentioned at least one side effect. And the largest proportion of those side effects were joint and muscular pain, musculoskeletal pain, hot flashes, osteoporosis, and weight gain. None of these are mentioned with any degree of frequency on the label for these drugs. They're all listed as less than 2% in the phase 3 trials. So it's sort of a compelling argument for using these types of data, at least for hypothesis generation. So we found that they do experience side effects more frequently than seems to be noted on the labels. But however, there's no denominator, and I'm very quick to point that out. There's no denominator here, so we're not talking about rates, no proportions. This is just simple hypothesis generating data. But they're suggestive and something worth going out and looking at. Well, so validation is needed, and we did that to some extent. We checked with a number of primary care docs who treat breast cancer patients with aromatase inhibitors in their practice, and we found that, yes, indeed, they're seeing many patients like this as well. Okay, so just to close out, some regulatory issues, consent. Nobody's consenting, actually, to having their data looked at this way. We need to have some really good anonymization routines, and we've developed them. We've actually published one, and if anybody wants to hear about it, I'm happy to discuss that. Terms of service and data use agreements can be very difficult to comply with, and then there's always serendipity. Sometimes you find things that you never wanted to see, and sometimes they can involve some very serious events. Okay, so basically discussion boards are a very rich source of data for us, and I would think to close there because I'm well over time. Okay, thank you.